I'm Dr. K.AMUDHA from Biochemistry department. Today we can see the blood clotting disorders like von Willebrand disease and hemophilia. The von Willebrand disease is a lifelong, that is a bleeding disorder in which the blood does not clot well. So the people with this disease have low levels of von Willebrand factor, a protein that helps the clotting of blood. Most people of this disease are born with it, having inherited it from one or both parents. However, warning signs such as heavy bleeding after a dental procedure might not show up for years. This von Willebrand disease can be cured, but with the treatment and self-care, most people with this disease can lead active lives. So when you see the symptoms of von Willebrand disease, many people with this disease don't have it because the signs are mild or it may be absent. The most common sign of this condition is abnormal bleeding. There are 3 types of disease. The amount of bleeding varies from one person to another depending on the type and severity of the disease. If there is von Willebrand's disease, they might have excessive bleeding from an injury or after surgery or after dental work, nosebleeds that can't stop within 10 minutes, heavy or long menstrual bleeding, that is the blood clots greater than 1 inch, that is 2.5 centimeters in diameter in the menstrual flow. When the blood is present in the urine, or blood will be present even in the stool also. Then easy bruising and symptoms of anemia including tiredness, fatigue and shortness of breath. Next we'll see the causes of Willebrand's disease. The usual cause of von Willebrand's disease is an inherited abnormal gene that controls the von Willebrand factor. That is a protein that plays a key role in blood clotting. When there is low levels of this protein, or if it does not work as it should, small blood cells called platelets cannot stick together properly nor attach themselves normally to the blood vessels when an injury has occurred. This interferes with the clotting process and can sometimes cause uncontrolled bleeding. Many people with this von Willebrand's disease also have low levels of factor VIII. It is another protein that helps in the clotting. The factor VIII is involved in another inherited clotting disorder called hemophilia, but unlike hemophilia, which mainly affects males, von Willebrand's disease affects males and females and is usually milder. Rarely, von Willebrand's disease can develop later in the life in people who does not inherit an abnormal gene from the parent. This is known as acquired von Willebrand syndrome, and it is likely caused by an underlying medical condition. Autosomal recessive inheritance patterns. The main risk factor for von Willebrand's disease is having a family history of it. The parents pass the abnormal genes for the disease to their children, and very rarely the disease skips generation. This disease is usually an autosomal dominant inherited disorder, which means you need an abnormal gene from only one parent to be affected. If they have the gene for von Willebrand's disease, you have a 50% chance of transmitting this gene to your children. The most severe form of this condition is autosomal recessive, which means both of the parents have to pass an abnormal gene to you. We'll see the complications. Rarely, von Willebrand's disease can cause uncontrolled bleeding, which can be life-threatening. The other complications of von Willebrand disease can include anemia. That is, women who have heavy menstrual bleeding can develop iron deficiency anemia. And the second is swelling and pain. This can be a result of abnormal bleeding in the joints or soft tissues. We'll see diagnosis. Mild forms of von Willebrand's disease can be difficult to diagnose because bleeding is common and for most people does not indicate a disease. However, if the doctor suspects that you have a bleeding disorder, he or she might refer you to the blood disorder specialist, that is to the hematologist. To evaluate from Willebrand disease, the doctor will likely ask detailed questions about the medical history and check for signs of recent bleeding. The following blood tests are likely recommended. Von Willebrand's factor antigen. So this determines the level of von Willebrand factor in the blood by measuring a particular protein. The next one is von Willebrand factor activity. So for the activity, there are a variety of tests to measure how well the von Willebrand factor works in the clotting process. So the next one is factor 8 clotting activity. And this shows whether there is abnormally low levels and activity of the factor 8. Von Willebrand factor multimers. And this evaluates the structure of the von Willebrand factor in the blood, its protein complexes, and how its molecular breakdown. This information helps to identify the type of von Willebrand's disease we have. The results of these tests can fluctuate in the same person over time due to factors such as stress, exercises, infection, during pregnancy, and during medications. So, some tests may be repeated. If you have a von Willebrand disease, your doctor might suggest the family members undergo tests to determine if this condition runs in the family. Now coming on for the treatment, even though von Willebrand's disease has no cure, treatment can help to prevent or stop bleeding episodes. The treatment depends on the type and severity of the condition and how you have responded to previous therapy by another medications and conditions. The doctor might suggest one or more of the following treatments to increase the von Willebrand factor and strengthen the blood clots, or in women, control heavy menstrual bleeding. Desmopressin. This medication is available as an injection or nasal spray. It's a synthetic hormone that controls bleeding by stimulating the body to release more of von Willebrand's factor stored in the lining of the blood vessels. The next is replacement therapies. These includes infusions of concentrated blood clotting factors containing von Willebrand factor and factor 8. The doctor might recommend them if desmopressin is not an option for you or was ineffective. So the another replacement therapy approved by the FDA for treating adults 18 and older is a genetic engineer von Willebrand's factor product, because recombination factor is made without plasma and it can reduce the risk of the viral infection or allergic reaction. clot stabilizing medications. These antifibrolytic medications such as aminocarpic acid can help stop bleeding by slowing the breakdown of the blood clots. Doctors often prescribe these drugs after or before a surgical procedure or tooth extraction. Then the next one is drugs applied to cuts. A fibrin sealant placed on a cut helps cut trial bleeding. This is applied like glue using a syringe. There are also over-the-counter products to stop nosebleeds. Next we'll see hemophilia. Hemophilia, it is a common hereditary coagulation blood disorder due to deficiency of reduced activity of clotting factor 8 or factor 9. This disorder is an X-linked recessive disorder. Hemophilia is a bleeding disorder that slows down the blood clotting process. It is transmitted via females to man who are sufferers. The female who carry a single mutated gene are generally asymptomatic and they are not affected. People who have hemophilia often have longer bleeding after some sort of contact to injury. People who have severe hemophilia start to have spontaneous bleeding in the joints and muscles and even all over their bodies. Hemophilia is more in males than females. There are 3 types of hemophilia, that is hemophilia A, hemophilia B, another one is hemophilia C. We'll see one by one. So coming on for hemophilia A. Hemophilia A is a genetic deficiency in clotting factor 8 which causes increased bleeding and usually affects the males. In the majority of the cases, it is inherited as an X-linked recessive tract, though there are cases which arise from spontaneous mutations. The factor 8 medication may be used to treat and prevent bleeding in the people with hemophilia A. So when you see the signs and symptoms, in terms of symptoms of hemophilia A, there are internal or external bleeding episodes. Individuals with more severe hemophilia suffer more severe and more frequent bleeding, while others with mild hemophilia typically suffers more minor symptoms except after surgery or during serious injury. Moderate hemophilia have variable symptoms with manifest along a spectrum between severe and mild forms. The hemophilia leads to the severely increased risk of prolonged bleeding from common injuries, or in severe cases, bleeding may be spontaneous and without obvious cause. Bleeding may occur anywhere in the body. Superficial bleeding such as those caused by shallow ulcerations may be prolonged, and the scab may easily broken up due to lack of fibrin. While superficial bleeding is troublesome, and some of the more serious sites of bleeding are joints, muscles, digestive tract, brain, and muscle and joint hemorrhages, and though typically not life-threatening, joint bleeding is one of the most serious symptoms of hemophilia. So repeated bleeds into a joint capsule can cause permanent joint damage and disfigurement resulting in chronic arthritis and disability. Next we'll see the complications of hemophilia A. One therapeutic conundrum in the development of inhibitor antibodies against the factor VIII due to frequent infusions. These develop as the body recognizes the infused factor VIII as foreign, as the body does not produce its own copy. In these individuals, the activator factor VII, which is a precursor of the factor VIII in the coagulation cascade, can be infused as a treatment for hemorrhage in individuals with the hemophilia and antibodies against replacement for the factor VIII. Oral manifestation. The oral manifestation are characterized by frequent bleeding of multiple sites that is frequently seen as jejunal and post-extraction hemorrhages. The symptoms depends on the severity of the hemophilia. In the case of severe hemophilia, patients may complain of multiple oral bleeding episodes throughout their lives. These hemophilia patients are considered to be a special group of patients as routinely done procedures may be fatal in them. It was seen that almost 14% of all hemophilia patients and 30% of the cases with a mild type of hemophilia have been diagnosed early following an episode of severe oral bleeding, of which the most common site was the tongue. We'll see the genetics of hemophilia A. This hemophilia A, it is inherited as an X-linked recessive tract. It occurs in male and in homozygous female. However, mild hemophilia A is known to occur in heterozygous female due to X inactivation. So it is recommended that the levels of factor VIII and IX be measured in all known or potential carriers prior to surgery and in the event of clinically significant bleeding. About 5 to 10% of the people with hemophilia A are affected because they make a dysfunctional version of the factor VIII protein, while the remainder are affected because they produce factor VIII in insufficient amount. Of those who have severe deficiency, 45 to 50% have the same mutation and inversion within the factor VIII gene that results in the total elimination of the protein production. Diagnosis. Following a symptomatic event, patients may be diagnosed by testing for the time it takes for the blood to clot, levels of clotting factor in their blood, or by genetic testing. So when you go for treatment, hemophilia A is a treatable disease and there are different ways it may be treated. So coming on for the first one, you can see it is replacement therapy. Here the missing clotting factor VIII is replaced to prevent complications, and this generally works well. The replacement therapy is usually used as an epidotherapy to treat patients with mild to moderate hemophilia A after an injury. Some patients with mild forms of the disease may also be treated with desmopressin, which rises the levels of all clotting factors in the blood. Then next we can go for antifibrolytics, which slows the breakdown of clotting factor in the blood and used to treat milder forms of the disorder. And the patients with severe hemophilia A may need to receive periodic factor VIII infusions to prevent bleeding, in an approach referred to as a prophylactic theory. Here, the patients can administer these infusions at the home themselves if they receive training. This is important for the people with severe forms of the disease because The infusion works best within 1 hour of the bleeding episode. The goal is to stop the bleeding as soon as possible. Next we'll see hemophilia B. Hemophilia B, it is also a bleeding disorder caused due to inherited mutation of the gene for factor 9, and this results in the deficiency of the factor 9. It is less common than factor 8 deficiency, that is hemophilia A. The hemophilia B was first recognized in 1952, and it is also known as Christmas disease, named after Stephen Christmas. He is the first patient described with hemophilia B. In addition, the first report of its identification was published in the Christmas edition of the British Medical Journal. Next we'll see the causes. During bleeding, a series of reactions takes place in the body that helps blood clots. This process is called as the coagulation cascade. It involves special proteins called coagulation or clotting factor. There is a chance of excess bleeding if one or more of these factors are missing or not functioning like they should. The factor 9 is one such coagulation factor. Hemophilia B is a result of the body not making enough factor 9. This hemophilia B is caused by an inherited X-linked recessive trait with the defective gene located on the X chromosome. Females have 2 copies of X chromosomes. If the factor 9 gene on one chromosome does not work, the gene on the other chromosome can do the job of making enough factor 9. But the males have only 1 X chromosomes. If the factor 9 gene is missing on the boy's X chromosome, he will have hemophilia B. For this reason, most people with hemophilia B are male. If a woman have a defective factor 9 gene, she is considered as a carrier. This means the defective gene can be passed down to their children. Boys born such women have a 50% chance of having hemophilia B, but their daughters have a 50% chance of being a carrier. So females are always a carrier, and the males are the one which have this disease, hemophilia B. All female children of men with hemophilia carry the defective gene. The risk factors for hemophilia B includes family history of bleeding, and next is being a male. We'll come for symptoms. Severity of the problems can vary. Prolonged bleeding is a main symptom. The bleeding problems usually show up when the infant starts crawling and walking. Mild cases may go unnoticed until later in the life. Symptoms may first occur after surgery or injury. Internal bleeding may occur anywhere. The symptoms includes bleeding into joints with associated pain and swelling, blood in the urine and also on the stool, bruising, urine gastrointestinal tract and urinary tract bleeding, and nosebleeds, prolonged bleeding from cuts during tooth extraction and also during surgery, the bleeding that starts without cause. We will next go for exams and tests. If the first person in the family to have a suspected bleeding disorder, the healthcare provider will order a series of tests called a coagulation study. Once a specific defect have been identified, the other people in the family will need tests to diagnose the disorder. The test to diagnose the hemophilia B includes partial thromboplastin time, that is PTT, prothrombin time, bleeding time, fibrinogen level, and serum factor 9 activity. So after this, they have to go for the treatment. The treatment includes replacing the missing clotting factor, and the patients should receive factor 9 concentrates. How much you get depends on severity of the bleeding, site of bleeding, weight and height. To prevent a bleeding crisis, people with hemophilia and their families can be taught to give factor 9 concentrates at home at the first signs of the bleeding. People with severe forms of the disease may need regular preventive infusions. In severe hemophilia, you may also need to take factor 9 concentrate before surgery or certain type of dental work. And they should get hepatitis B vaccine. The people with hemophilia are more likely to get hepatitis B because they may receive blood products. And some people with hemophilia B develops antibodies to factor 9, and these antibodies are called inhibitors. The inhibitors attack factor 9 so that it is no longer works. In such cases, a man-made clotting factor called 7A can be given. Next we'll see hemophilia C. Hemophilia C, it is a rare genetic disorder, and this is caused by missing or defective blood clotting protein called factor 11. This disease was first recognized in 1953 in patients who experienced severe bleeding after dental examination, and to this day it is still not very well known. Signs and symptoms. In terms of the signs and symptoms of hemophilia C, unlike individuals with hemophilia A and B, people affected by it are not ones to bleed spontaneously. In these cases, hemorrhages tend to happen after a major surgery or injury. But however, people affected with hemophilia C might experience symptoms closely related to those of other forms of hemophilia, such as the following: oral bleeding, nosebleeds, blood in the urine, and tonsils. So when I come for the causes, factor 11 deficiency is inherited, meaning it is transmitted from parent to child. The disorder may be caused by the myriad of the genetic mutations, which is why symptoms vary gently in people with deficiencies similar to that of factor 11. Unlike classic hemophilia, that is A and B, hemophilia C affects men and women equally, as the faulty gene is located on the chromosome 4. We'll see diagnosis. Factor 11 plays an important role in the clotting cascade, which leads to clotting. It helps to generate more thrombin. It is a protein that converts fibrinogen to fibrin, which traps platelets and helps hold a clot in the place. This hemophilia C is suspected when an individual presents symptoms of unusual bleeding, or when a pre-surgery coagulation test known as coagulogram indicates a clotting anomaly. Other tests used to diagnose hemophilia C includes a bleeding time test, platelet function test, and prothrombin test. Next we'll see the various treatments which are available for bleeding. These includes fresh frozen plasma, that is a blood derivative that is rich in coagulation factor. And we can also go for factor 11 concentrate. It is delivered in a form of powder and treated to inactivate blood-borne viruses. And next is by hormone therapy. And next we can see it is DDAVP or the synthetic hormone desmopressin. This encourages coagulation by temporarily increasing the factor 8 and von Willebrand's coagulation factor. In this topic, we have discussed about von Willebrand's disease, hemophilia, and the types of hemophilia such as hemophilia A, hemophilia B, and hemophilia C, its speciality, how it is causes, the symptoms, and the diagnostic method and treatment for that. Thank you. Thank you. Thank you. Thank you.